I am so excited to introduce the girl who has 9 lives. Here today with us is Ashley Spencer. She shouldn't be here because she should have died so many times by now, but she's here, and she's not just here to survive. She's here to thrive and help others too. So Ashley, say hi to us today.
Hey everybody, how are you guys all doing? I hope you enjoy this episode because I love sharing my story and doing advocacy and spreading the journey of what I've been through and how I can help others.
Thank you so much, Ashley. So Ashley has a very unique condition that was really hard to diagnose. So Ashley, can you tell us, what was your prednisone story been like?
I started taking prednisone when I was 16 years old. I am now 31 and I am still on prednisone. But when I was diagnosed with my rare autoimmune disease called eosinophilic granulomatosis with polyangiitis, so the acronym for it is EGPA, or formerly known as Churg-Strauss syndrome. I had a pharmacokinetic study done, and it told me that my body didn't process prednisone correctly. So they put me on methylprednisolone, which actually works a little bit better, but you have to take a higher dosage of it and it causes more harm to the body.
So you've been on it essentially on and off for 15, 16 years now. Is that right?
Correct.
Wow. Oh my goodness.
And
So
every time I have a mast cell reaction or go into anaphylaxis from food allergies, I always have to get 125 milligrams of Solumental through IV.
wow. So you've had 125 milligrams Solumental. What would you say your highest oral prednisone dose has been?
My highest oral prednisone dose has been, when it was prednisone, 80 milligrams.
80 huge whopping milligrams. Oh my goodness. That is.
And they taste terrible.
Yeah. Can you describe what it tastes like to you?
Just eat chocolate afterwards. That's the best way to make it taste better and get rid of the taste.
Is it like a metallic-y taste, or what? How would you describe it?
I would take, I don't even know. It's not, definitely not a metallic-y taste. It's just a taste that lingers in your mouth that you cannot get rid of.
Yeah, I totally remember that. Ugh.
What do you think it tastes like?
I thought it tasted like a old metal spoon, like a taste of that, and then it never went away. I don't know.
Okay.
It's hard to describe for sure.
It is very hard to describe.
It's gross though. Yes.
It's very gross. And it just like, it lingers and it lingers. And then I swear it's still there when you have to take your next dose, and then it just lingers even more.
Mm-hmm. Exactly. So you've had all the way up to 80. What is your typical like dose that you're usually on, or that you're on right now?
My dosage right now is 32 milligrams of methylprednisolone. So I split it. I take 16 milligrams in the morning and 16 at night, because with EGPA, or I guess anything, they want to keep it constantly with an autoimmune disease in your body. Especially because I have gastroparesis. So it takes a long time for it to absorb and then stay within the bloodstream.
Yeah. So for those of you who don't know what gastroparesis is, that's a problem with the contraction of the gut so that things don't absorb and digest at the same rate for people.
So that makes me very vitamin deficient. So I'm B12 deficient, B6 deficient, very potassium deficient. Like I just don't get any of my like vitamins at all, no matter if I take them by supplements, if I eat them. It's very hard.
Yeah. So you really need supplementation, and any way you can get it, right?
Yeah. A lot of times I get them through IVs or by subcutaneous shots like B12 and B6. And then when I lived in Cleveland, my iron was so bad for a year and a half, I got iron infusions every month, which is so rare.
And that is so hard because it takes forever, right?
Those you can get done within an hour and a half. IVIG takes 6 hours, which I get done.
You've had those too. Do you still get IVIG?
Yeah, because I have common variable immune deficiency. So if people don't know what that is you're born with it. And it just means your body doesn't have an immune system to begin with. So it makes you very comparable to getting everything and anything.
Yeah. That for some reason your body's not making all of the right
immunoglobulins. So I'm IgG and IgA deficient.
Gotcha. Your list keeps growing. Things that
I know.
you have to deal with. Oh my goodness. Okay, so.
But I take it with a grain of salt. Like, I just sit here and I smile about it. Like, nobody would know. Like, and that's what I mean. Like, I love teaching people about it and helping. That's like what gives me my drive to keep going.
So I didn't introduce what you do when you're not advocating for people. So you want to tell us what you're able to do, even though you have all of this going on?
I work at ATI Physical Therapy, and I am an occupational support specialist and a physical therapy tech, because originally I was in school to be a physical therapist, but was pulled out because of my autoimmune disease. So I couldn't finish, but I still do everything up but stretching, like, because of how much I had learned in school. And then I know insurance from working as a patient service specialist at NovaCare. So I do a dual job, which is really cool, because then I know how to tell the patients about insurance information and stuff like that.
That is so vital for people, because it's a whole new language and landscape of bureaucracy and misery. And if you don't speak it, then you can just get taken advantage of, right?
Yeah.
Oh. So I know you have an amazing story to tell us that has to do with a flight.
Sure. I'll tell you that story.
This story just kills me. So please go ahead.
This story actually made national news. So if anyone has any extra time on their hands, you can Google Ashley Spencer, American Airlines. What happened was I was just boarding a flight from Philadelphia to Cleveland. This was actually when I was going to Cleveland for a second opinion for my rare autoimmune disease. There was a lot of irony in it with what happened. There were angels watching over me that day, definitely. When I was in flight, I went into anaphylactic shock really bad. The bag of chips I was eating were actually cooked in peanut oil, but were not listed on the bag, which is what the FDA is trying to push more for, with like oils and stuff to be listed on bags.
Like, how can they get away with that? Like, peanut oil? It's not listed.
It's like a certain percentage or something like that you have to list, because like right now it's just like seeds and stuff and things like that. So what happened was I started getting motion sickness, what I thought was motion sickness. So I said to my mom, because my mom was going with me to the appointment, and she's like, just go back to the bathroom. Well, I started getting hives, and I was just like, maybe I'm just nervous, anxious. So, because I don't like flying. And then I get in the bathroom and I notice my throat starts getting tight and I'm getting like hives everywhere. So what I threw up, because my body was trying to get it out, which is your natural body's reaction to getting like a food allergy out. So what I thought was 5 steps out of the bathroom, just because I was like, I need to get out of this bathroom or I'll die in here because I don't have my EpiPens in here. So what I thought was 5 steps, I took out of the bathroom. I just face planted. And the first thing that was said to me was, what drugs did you take in the bathroom? Because they stereotype age groups, which is terrible. And thankfully, I had my allergy alert bracelet on with my disease that I was able to show. So then I said to the lady, because I could barely speak at this point because my throat was closing so bad, because I'm highly allergic to peanuts, like even the smell of it will close me up. And if I touch it, it'll close me up. Like, and I could eat peanuts my whole life. At the age of 24, after I started chemotherapy agents for my autoimmune disease, that's when I started getting all these food allergies.
Really like a side effect, right?
It changed everything. It even changed my hair quality. When I lost it, it came back in very thick and very wavy.
You went from like straighter and thinner to thicker and wavy.
Mm-hmm. So then what happened was they administered my 2 EpiPens, but before they did that, they called for, if there's any medical professionals on board, please come to like help. So Dr. Eric Keel, who was actually a Cleveland Clinic doctor, came.
What?
And I was just like, you're a Cleveland Clinic doctor? I said, I'm actually flying to the Cleveland Clinic because I'm going for a second opinion. I was able to like get that out after they gave me my first EpiPen. Then I started going in and out of consciousness again. And then Dr. Blake Cameron was from North Carolina, from Duke. He was a nephrologist. Dr. Eric Keel was a cardiologist, which is key. And Dr. Eric Keel did like an amazing job. They both did. I'm sorry, just like it chokes me up because I was going in and out of consciousness. So they gave me the second one, and Dr. Eric Keel was just fighting for them to land the plane because there's an on-ground doctor that says, no, like she's fine. Just keep going to Cleveland. And then he says, you don't understand. She will die on this plane because she suffers from a rare autoimmune disease that makes her allergic reactions 20 times worse. He's like, I administered 2 EpiPens. She's blue. And because your reactions are worse when you're 35,000 feet up in the air and the cabin pressure, even with the oxygen on. So then they go in the emergency medical kit. And when I mean that they aren't stocked properly, there was no like epinephrine for anaphylaxis. There was 5 Narcan for if I had overdosed.
If you had actually been injecting something illegal in that bathroom.
They were ready. They're
ready for that. They're ready for illegal behavior, but not for like an allergic reaction.
But they had a cardiac dose of epinephrine. So since Dr. Eric Keel was a cardiologist, he was able to quickly think in his head how to make that an anaphylactic dose. So then he did it, drew it up, and gave me another thing. And then they landed the plane in Pittsburgh. But when they were landing the plane, I didn't even say this on the podcast that I was on. He was trying to put an IV in my arm, and none of us were buckled in during landing. And he's like, I just want you ready to go so they can start pushing like Benadryl and steroids and everything like that. He was truly an angel up there. And like this whole like tattoo piece is all about the plane incident. It tells a story. Like there's 3 doves and it's for the flight attendants, 2 wings and it's for the 2 doctors, and then there's the plane, and then there's the stethoscope with the heart for Dr. Eric Keel. And then I honestly did not believe, I didn't have faith. I didn't believe in God until that happened because of being so sick for so long. And then angels aligned because I was just, that was, it's the irony of it, like Cleveland Clinic doctor, and I was flying there. And I think that's why I got picked up and made national news.
That is amazing. The irony is just stunning. And I mean,
I actually,
I don't believe there's such thing as coincidences. Like, it's not, there's no way 2 doctors would have been there, the exact right kind of doctors, if there wasn't a divine intervention there. Like, that's just too.
I presented them both with like plaques and everything.
Wow.
And then when I got to the Cleveland Clinic and they were working me up for the drug Nucala, which was a game changer that helped me get down and lowered off of steroids. That's a game changer, seriously. They had to do an echocardiogram of my heart, and that's when they had found a mass. And 3 doctors come in at 4 a.m. into the room, and they were like, excuse me, we need to talk to you. They didn't even say my name. They're like, they were just dropped the bombshell and were like, you have we're cardiologists. You have a mass in your heart. And I was like, oh, no. You got the wrong girl. That she's the one with all the problems next door, like the next bed. That's her. And they're like, are you Ashley Spencer? And I said, yeah. They're like, can you get your mom and your dad on the phone? It's 4 a.m. At 6 a.m. we're taking you down for a transesophageal echocardiogram. And I was just like, what? But then they didn't do it then. So later on that day, guess who came in to see me to explain the procedure? Dr. Eric Keel.
Oh my heavens. You're like, hey, bud, thanks for saving my life once. Do it again.
So he came in and explained it, and he was following me like all like through the notes and stuff. But because like we had already built a bond, like he wasn't really allowed on the case. So
I guess that makes sense. Yeah. But wow. So you mentioned Nucala and how that was game changer. So I'd like to know, what are some alternative medications for EGPA? It sounds like Nucala might be one. Can you explain how you ended up on it?
I ended up on Nucala because that's what I was flying to the Cleveland Clinic for, was that drug. It's Nucala is its like brand name. It's also goes by mepolizumab. Fantastic drug. I went from blowing a 150 on a peak flow to by my 6th month, I was blowing a 550. I went back to being able to working out and just feeling normal again. My lungs, no pulmonary infiltrates. They were crystal clear. Like I hadn't had that. My PFTs were normal, like, and they were like through the roof, like with over 100% blowing. Like I haven't had that since probably like 12 years old.
Wow. So for those who don't know what she was just talking about, she's talking about how with EGPA, there's often a hard time breathing, like asthma. And the PFTs are the pulmonary function tests, where you have to blow into a tube to see how hard you can blow to see if you're really sick or not. And it sounds like the Nucala allowed you to breathe better than you had in decades.
Mm-hmm. Nucala is also showing to help neuropathy, which I noticed it did help my neuropathy a little bit as well.
Tell us about your neuropathy, because so neuropathy means like nerve weirdness, pain, and inflammation and things. So
Well,
tell us, what was yours like?
I actually had the mononeuritis multiplex with my EGPA. So that affected me from the knees down in both legs. And I actually went to sleep one night and then I woke up and I had no ability to walk at all. And I lost the ability to go to the bathroom as well. So I actually have a bladder stimulator in my back that now, after being on Cytoxin for 6 months, it gave me some function back. So now the bladder stimulator, which connects with the sacral nerve, it gives the impulses to stimulate the bladder, so I know when to go. But my peripheral neuropathy is controlled with Lyrica and Nucala, and it's so much better now. I definitely think the Nucala is helping, because when I was just on when I was on gabapentin, which is also known as Neurontin to people, it did absolutely nothing, and I was on the 3,800 milligrams.
Wow, you're on like max doses.
Yeah, and I was still in excruciating pain because I had the mononeuritis multiplex, and I like barely could walk, and I felt like people were shoving nails in my legs because of the pins and needles.
Oh.
But now with the Lyrica and the Nucala, that I think that gives me the ability to be able to work and stand on my feet and everything.
So you had to jump through a lot of hoops to get to that Nucala. You had to first get yourself all the way to Cleveland, right?
I had to fight for it myself because the people in Pennsylvania wouldn't give it to me. And I actually sat on the board with GlaxoSmithKline and spoke about it, even though I didn't know about it, but I did a lot of research on it with other EGPA people that were on it already. That's how I met people, and they were like, you need to get on this drug. It's a game changer. So I went back to people in PA and was asking about it. And they were just like, no, like it's not truly FDA approved yet. And I was like, it's going to be by December 2017. Like, we just had a huge meeting. Like, I went to Chicago and spoke September 2017 with them. Who did I go with? Vasculitis Foundation.
Wow. So you've been advocating for a long time.
Yeah.
And so you had to get yourself to the Cleveland Clinic. You had to talk to the drug manufacturer people, FDA approval people, and then how did you end up finally getting it?
First appointment, I spoke with Dr. Kotri, the pulmonary doctor, and she looked over my my x-rays of my lungs, and she's like, you have so many infiltrates in your lungs, and the problem is my eosinophils are 0, and that's because I'm on so many steroids to keep them down. And she's like, I'm just going to send them your x-rays of your pulmonary infiltrates. You definitely qualify for 300 milligrams of the Nucala. And even the rheumatologist said that, she's like, I don't know how they're bypassing and looking past this in Pennsylvania. You have EGPA. You have every signs and symptoms. You've had 5 sinus surgeries. That's one qualification. You have pulmonary infiltrates. That's one qualification. You have opacities in your lungs. That's another qualification. You have mononeuritis multiplex. That's one. You have peripheral neuropathy. That's one. That's 5 out of the 6.
Yeah. And then the other one's just hiding. If we stop the
It's not
steroids, you're
even
in a bit of a
hiding. I
loophole,
had the
right?
biopsy. It didn't show the eosinophils in there again because I had that was on the steroids, but it showed vasculitis tides or whatever.
Uh-huh.
So I have it 110%.
Yeah, but it's a rare disease and it's hard to find the right doctor, right? Who can actually
Right.
give you a
And I
proper
found
diagnosis.
them at the Cleveland Clinic.
So how long did you basically go undiagnosed, like properly
Six,
diagnosed?
how long did I go undiagnosed?
Mhm.
16 to 22, so 6 years, which that was very, very detrimental to my health. Because by the time I got diagnosed, I was in stage 3. And
Wow.
for those who don't know, there's 3 stages. There's the allergic stage, hold on, I always get this confused. There is the allergic phase, which is asthma, allergic rhinitis, and sinusitis. So I had that from age 16 to 18. Then I had the eosinophilic phase, which is the main pathologic findings of eosinophils, organs, heart, lungs, kidneys, etc. Well, I didn't have the eosinophils, but I started having pulmonary infiltrates really bad, which still counts as the eosinophilic phase. And then I was in the vasculitis phase. And this is when they actually took me seriously and stopped calling me crazy, because that's what they did best. Oh, it's all
That's
in your head.
amazing.
Like,
Like how can that be
how
in
am
your head?
I putting pulmonary infiltrates in my lungs? How am I
That's
blocking
magical.
how am I blocking my nose up with nasal polyps? Like,
Yeah, that's
if
not
I
in your
can do
head.
that, I'm a magician.
Yeah.
And then then the vasculitis phase was the purpura and the peripheral neuropathy, which was at 22. And then that's finally when I said, you know what? I'm going to National Jewish out in Denver because my breathing was so bad and it was recommended by so many people. And when you go to National Jewish, they keep you for 2 weeks and you have an
Wow.
extensive workup. They even do a bronchoscopy with the lung biopsy, and stuff showed there. And that's when I got the tentative by Dr. Malecki. I still remember her name because I swear she was a godsend, because even though it was just like, I finally had a name for the disease, but then I came back here to Pennsylvania and it was like nobody still believed me. There was no way.
And so what would you say to others who feel like they're being told it's all in their head, that, like this isn't a real thing? Like, how did you keep persisting and getting the answers? Like, what would you tell other people to do?
Well, the first things first is the patient knows their body. So you need to fight for yourself. Never give up. You are your best advocate. And if you don't feel that you're a good advocate, find a caregiver or a friend, someone who will go with you so you don't feel like you're being bullied in there.
That is so vital, because it goes so fast. You only have a few minutes, right? And they're speaking
And
another language,
mhm,
and you can feel so overwhelmed emotionally just being there.
that you
I,
can't
I mean,
even think to get the questions out.
yeah, I speak the language, and I still felt overwhelmed. It's like, what can you do to feel like that you are fully advocated for?
Exactly.
Oh, it's rough. So what other alternative medications have you had? You mentioned Cytoxin, and I know that's a chemotherapy drug.
Mhm.
So Cytoxin, what else have you?
They started out with Imuran. I got severely sick on that because my stomach is just like, it doesn't tolerate things well. So I had a lot of vomiting on that. Cellcept vomiting. methotrexate pills, vomiting. So then I've been on methotrexate subcutaneously for as long as I can remember, still on it, except for when I was on Cytoxin through my port, because we tried rituximab and I had a severe allergic reaction and was intubated.
Which is so shocking. I personally took rituximab. It was what cured me of, not necessarily cured, but put my autoimmune condition into remission. Like I would still be on prednisone or dead or something if it weren't for rituximab. And I was terrified to say, yes, I want the rituximab because of the risk for that side effect. So can you tell us a little bit more about it? Because people are like, I'm terrified it's going to happen. And my one friend said, well, it's like super, super rare. He's been a pharmacist.
I fall into that 0.1% for everything.
For everything.
So I hate to say it, but I do. And what happened was, it was my second time getting it. And because like reactions can happen, like not the first time, but like the second or the third time. So they were trying to build it up, and every time they built it up, I started getting redder and redder, and I was wheezing loud. So I was like, I need more Benadryl. I'm screaming over there. And they're like, we can't give you any more. And I'm like, well, I need an inhaler or something. They come over and they listen to me and they're like, we're calling a rapid response. Your throat's closing. And I'm like, what? Because this is the first time I was having like a severe allergic reaction like that, where I needed to be intubated. So now same thing, same hospital. And the surgical center is literally, which I was telling you about, right next to it. This time they don't call an ambulance. They just wheel me right up. They call.
Why? Why?
Mind blown.
Mind blown for sure.
I guess because I wasn't being bagged. I don't know.
So you were on the verge of closing off.
Yeah.
Intubated. So like they had to put something down your throat so that they could keep your throat open so you could keep breathing.
Yep.
And you were awake for this?
No, what they do is they give you sucks and what's the other one called? Rock.
Mm-hmm.
Isn't it sad I know the medicines names by now?
Impressive. Yes, that is very impressive.
Macaronium or something.
Yep. Those make you so you don't know what's going on. They close your eyes and you're in la la land.
I've literally been to the point where the one time I was paralyzed, I could hear everything going on and I couldn't move my body.
So you could hear it and you were aware, but they had completely paralyzed you.
Mm-hmm.
And they were doing the breathing for you.
I was trying to move my body to let them know like I need something, and
that must be disturbing.
Yeah, very much.
Not being able to move your body and like being aware that you can't move your body.
Yeah.
Oh, so this is why we don't want to get COVID. Yeah.
Yeah, exactly what Alex had said. You don't want to be on a ventilator, anybody. So go get vaccinated. Take COVID seriously. Ventilators are not fun. And not only that, you can cause a lot of risk to your vocal cords.
Yeah. How many times have you been intubated? Just that once or?
No. A lot.
Oh,
Too many to count because of my mast cell and food allergies.
Wow. I am so sorry. You have really been through so much. But what's so amazing about you is that you're still here to tell the tale, that you have done so much. I want to toot your horn for you to tell us what you did for other people so they don't have to go through what you've been through?
I'm sorry, what did you say?
Can you tell us what you've done so that other people don't have to go through what you went through?
Oh,
Or,
I spoke in Washington.
Mhm.
And in Washington, with FAIR, I'm now made sure that auto injectors are on all planes. So that way, nobody goes through what I went through after I ran out of tube, because if there wasn't a cardiologist on board to figure out that dose, I probably wouldn't be here. But like
Yeah.
I say to everyone, I have a purpose and a reason, and that's why I'm still here. And it's to advocate, speak to others, and make sure that I guess, how do I put this? I don't really know. Just make sure I inspire others to then go on and want to help others.
That is awesome. You're paying it forward so that your suffering isn't in vain, that what you've gone through matters so that other people don't have to suffer. And I applaud that. That is so wonderful. I can't imagine what it would be like to be on a flight and have a peanut allergy, because they used to always serve peanuts, right? And
Yeah.
then suddenly be allergic. And what if you forgot your own, or you didn't even know? Like, what if it was your first time being allergic with peanuts?
Yeah. Well, did you hear about that one kid who had a nut allergy, and that hot Dr. Mike saved his life?
Oh, he did? I haven't heard that story, but I know who Hot Dr. Mike is.
Google it.
I'll have to.
Yeah,
Because,
he didn't know.
wow. And like, oh, thank you for doing that, for making that difference so that when you're stuck up in the sky and there's no other way to survive, that there
But
will
we
be
still say,
definite
and I'm putting this PSA out there, still bring the 2 of your own always. Bring your Benadryl and have your inhalers.
yes, I completely agree. And don't have them in your checked luggage. Have them right next to you
In your purse.
in your
Or,
purse.
yes.
'Cause
Or
you
if
make
you're a
accessible.
husband or something, have your wife hold them for you.
Yes, precisely. Oh, those are really important public service announcements. So, Ashley, you are amazing. I have a few questions I always ask people at the end. So first of all, what is your go-to snack when you get the munchies from Prednisone?
I'm just going to say everything, but probably Hershey's chocolate bars, because they're the only ones that are made peanut and tree nut free and are not they're made on a totally different line and in a different part of the factory. If
Really?
nobody knew that has a peanut and tree nut allergy, regular Hershey's chocolate bars you can eat.
Oh, that is some valuable information. I had no idea. So I learned something. This is awesome. And then what is your last best advice for other prednisone warriors?
Make sure you take your vitamin D, your calcium, and make sure you buy her supplements, because when I first started taking them, they actually really did help me a lot. And now I just started taking them again. So they do work. So make sure you buy her. You take one in the morning and you take one at night, and you will notice a difference.
What did you notice was the difference for you?
They made me more energized.
That's awesome. I remember when you first got it, you went live on Facebook. You're like, you guys, this is amazing. I can't believe I can tell such a huge difference.
Yeah.
Awesome.
But they do work, everybody. So I would just try a month out.
Yeah. You try a month, money back, 100% money back guarantee if it doesn't work for you. So you can get it at nutranize.com. Thank you, Ashley. So Ashley is our woman with 9 lives. We should call her a cat or something. I love your Halloween decorations in the background. It's like perfect for this.
Thanks. It's called my Ray Dunn collection.
It's
You
beautiful.
ever heard of Ray Dunn?
I haven't, but I love the Mickey Mouse. That's hilarious.
Oh yeah, that's a little candy jar.
My little kids would love that. That is so cute.
We have to put it up high because my niece tries to grab it.
Mm-hmm. Yep. If that was accessible, that would be in pieces at my house for sure. Well, thank you, Ashley, for coming on and telling us your prednisone story all about EGPA and flights and saving the world for other people. So signing off as Dr. Megan, your prednisone pharmacist.
Bye guys. Thank you so much for having me. And remember, go to nutranize.com and get your pills. They will help you 100%, as well as vitamin D and calcium so you don't get osteoporosis or glaucoma. So watch out for those.
Exactly. Yes, you can get all of those nutrients in Nutranize Zone. See you later.
Bye, guys.
With the one, the only, the woman with 9 lives, Ashley Spencer. I'm Dr. Megan, the prednisone pharmacist, and Ashley, I interviewed her last week, and we were about ready to publish the latest YouTube video interview with her. And guess what? She used up one of her 9 lives. So I had to get her back on to tell you all about what's happening and how this has everything to do with the pandemic and vaccines and all sorts of things. So listen to the end so you understand that whole thing. All right, Ashley, tell us what happened.
Okay, so on Sunday, I was at Top Golf. And anytime before I eat, I always ask a manager, is there peanuts or tree nuts in any of their food? And they said no, but they failed to mention that their wings could be cooked in peanut oil. So I was eating the nachos and I was fine. And then I literally ate one wing. And within that, because I'm highly allergic to peanuts, like dust, touch, smell, literally sets me off. My throat closed immediately. And unfortunately, I was on a wait list because there's been a national shortage of EpiPens because Pfizer makes them. And if everybody knows, Pfizer right now is the one that's making the booster shots and pushing everything out for COVID. So epinephrine has kind of been on the back burner even since 2018 when there was a national shortage. And I don't know if everyone remembers, they had also boosted them from $100 to $650 to $700, which is absolutely insane. That's a rent payment for some people. How do you decide between, do I want to have medicine that can save my life, or do I want to eat this month and have a house?
And what's crazy about it is it expires so fast, right? Like, it's not like, oh, I'm going to spend $600 and it'll last me like 5 years. Nope. They
last 1 year. And then they were trying to push them out and say they last 4. And I don't know if you know, there was a lot of problems with the lot numbers with them not then injecting. So then you had to return them, but you couldn't get one back because there was the shortage was so bad.
So did you have an EpiPen when your throat was closing off?
No, I did not.
So what did you do?
I actually had oral Benadryl. So I attempted to take that, but it did not go down because I was closing so fast. So the manager called 911 immediately. Fire EMS showed up. He called them and said, we're going to need more paramedics. This is really bad. anaphylaxis. So they got there. They actually listened to me because of my rare autoimmune disease. I have no veins. I usually need ultrasound guided because I used to have a port and that got ruined. So I don't even want to talk about that story. That's on a podcast. So if anyone wants to listen to that story, that's pretty entertaining. Because that led to the blood clot in my heart. So I don't have any vein vascular access, but he listened to me and I said, you can go right here in my wrist. I'm going to tell you it's going to hurt, but just do it so you can get some drugs into me. But I was turning purple and they wheeled me and started running me out as they were pushing Benadryl. They gave me a double dose of Benadryl, 125 of Salumedrol, Pepsid. They gave me everything that they would give me at the hospital, but I was turning purple so bad and grabbing my throat, and I had stridor that they were talking and they were like, we're going to have to intubate her in the ambulance. And I just went like, you're going to have to do what? You're not a doctor. Like, I didn't want to be rude, but I was just like, are you like trained to do this? And he's like, honey, you are swelling very bad and you have no color and your saturation is in the 70s. So we need to do this to save your life. So they have to call in to the doctors, get permission, and then they did it. The last thing I remember them saying is pull over. So we have her, we're putting her to sleep now. When we say pull over so we can get the tube in.
Oh my heavens. Like they had to just stop for that moment while they're like scooping it into your throat.
Yeah, because they don't have a kaleidoscope in an ambulance. So they're just doing it blind.
Oh my heavens.
That's why I was freaking out. Because I have in my wishes no trach.
Oh my gosh. I mean, so I have an uncle and a cousin who are paramedics, and they told me that they were trained to do intubations, but it's not something they want to do or that they do very often, right? Because theoretically they can get you to the doctor, to the emergency room in time. But in this situation, you've been intubated how many times?
Way too many to even count because of the EGPA, which is an allergic granulomatosis. Then you have mast cell activation disorder. And then I have hereditary angioedema. So I had 3 things going against me. And I was just blowing up my face, my arm, my throat.
Oh.
And I still have the cough.
So they intubate you in the ambulance, and then you're out.
I was out cold.
They put you out. And so you got to the hospital, I'm assuming. Then what?
I was out for a while. I didn't wake up for a while. And then I was tubed for probably 20 hours. Then they took it out. And then I almost had to be intubated again because I rebounded. Because they cut my steroids way too fast. And you can't do that. And you know that as a prednisone pharmacist. So they took me from 60 every 6 hours to 40 every 12.
Whoa, that's a big drop.
Yeah. So I went into full blown, like back into anaphylactic reaction in the ICU.
So you had been admitted into the ICU on all of these injectable drugs, and they took your tube out and they started dropping doses as fast as they could, but it was too fast. And so then they had to put the tube back in?
No, they almost did. They did Bipap.
Oh.
Which I hate.
Which is so
claustrophobic feeling.
Claustrophobic. Like, for those who don't know what Bipap is, can you explain that?
Bipap is when they put this mask right here, but it's like they strap it all around, and it's the worst feeling in the world. I mean, the tube is the worst feeling in the world, but Bipap is just as bad. and they wouldn't give me anything for my anxiety. And I was just getting highly anxious with it on. And then my blood pressure was dropping severely low. I was like 88 over 53 because I was going back into anaphylaxis. So then I needed boluses of saline. And then they were pushing epinephrine, not giving it intramuscularly. They were doing it through IV, which hurts your heart really, really bad.
Yeah, because it's doing all sorts of things to save you, and that doesn't feel good at all.
No, and I'm like, I need something. You need to give me something. I was like, because I'm like, my heart, and I still have a clot in there. Like, so if that's not comfortable. Like, I'm afraid when they do that, like, it's just going to burst it when it starts to beat so fast.
Oh my heavens. So you're obviously home. How long were you there?
From Sunday to yesterday to this morning.
And today's Wednesday. So this happened on Saturday, and you just got home from the hospital yesterday. So
no, this morning.
This morning.
Yeah.
Well, I'm glad I caught you just in time to tell you.
Yeah, no, I wanted to share the story so you could add it in.
Oh my goodness.
And so I talked to CVS, and I was like, they're like, well, we can give you the generic. And I said, I don't want the generic because the generic is so hard to inject when you're in trouble. And I had another person try to help me with the generic before, and they ended up injecting it to them. And then they needed to go to the hospital because their heart was raised.
What? That is so crazy. Like,
that is not an easy one to do.
Yeah.
The generic
is so hard to use that they injected themselves. Oh my goodness. So we're talking about EpiPen here, and EpiPen is this miraculous injectable little pen that you can go straight through your pants into your thigh if you're in a complete emergency to save your life. But you're telling me that you can't even get it from the pharmacy.
No. So like I've been waiting, and I just called them again. I was like, when can you get the brand name in? I said I was intubated over the weekend. So they're like, well, we'll try to pull strings and see if we can get it in tomorrow by 5 o'clock. I said, you better. I said, I'm walking around with nothing right now.
That's terrifying. Like, are you home alone right now?
No, my parents are downstairs.
Oh, because it's like, what happens if you're home alone and you still don't have your EpiPen? Like, how terrifying is that?
It is terrifying because it gets to the point where when I close, I can't talk.
Yeah, because you're closing so fast now. Like, your body has gotten so
my reactions are getting worse and worse.
Wow. Oh my goodness, Ashley. So if you could talk to the CEO of Mylan or Pfizer, who's manufacturing the EpiPen, what would you say to them?
I'm sorry, what did you say?
You could talk directly to the CEO of Mylan or Pfizer that's manufacturing it for Mylan. What would you say to them?
I would say to them that this is a life-saving drug, just like COVID is life-saving right now. We need to focus on both. I mean, we've been in a national shortage of EpiPen since 2018, and the pandemic for COVID didn't start technically since 2020. So what is going on here? And why are we price gouging the drug?
Yeah, because they had a whole settlement for price.
Yeah, $345 million.
That, I mean, that is so twisted. And then to think that in other countries, like you sent me an article in Australia, it's $100.
Yeah, I know. I know people in Australia. I'm about to ask them Venmo the money and have them send it to me.
Seriously, that's not a bad idea. Like, oh my goodness, it's impossible. So you can't even get it. And if you do get it, it's
the generic
6 to 8 times more expensive than it is in any other country. And then if you are able to get it for that insanely high price, it's short dated. Like, the expiration date is not very far
and
away.
you have to always check the lot number when you get it to make sure it's not recalled already.
Yeah, because it's been recalled so many times. So just the process of acquiring and maintaining your EpiPen is like a part-time job.
Pretty much. And you got to make sure it stays in the right temperature or then it doesn't work.
And so if for other people who need an EpiPen, what is your best practice? How do you use it? Where do you keep it? Things like that.
I keep it in my purse and my purse is always on me. Now, if you're a guy, like, or a kid, they usually have the mom hold on to it, or like they'll keep it in like a special book bag thing that they make for them to carry. There's different ways, cool things that they have.
Cool. But you default to the purse, and if you had as many as you
And
need,
I
how
always
many
have
would you need?
Benadryl in my purse.
And
You always want to have at least 2, because first one can stop acting within 10 minutes. So if you're on the way to the hospital, you can take the second one.
And so are you taking pills of Benadryl or capsules, or?
Yeah, you take capsules.
Have you ever
till you
tried
get
the dissolving under your tongue?
No, I didn't even know they had that.
Well, there's like the kids version. It's
I've
just
taken, I take liquid, kids liquid Benadryl, that works.
yeah.
But I have to like take the whole bottle.
Right. It sounds like maybe we should get you some of the chewable kind that you could just put in your mouth and let it dissolve, because it doesn't sound like you're able to swallow anymore.
No.
Oh my goodness. Okay, well, Ashley, any last words of wisdom for us now that you've survived another of your 9 lives?
My thing is you suffer from food allergies, any type of allergy, make sure you keep Benadryl, an inhaler, and at least 2 EpiPens on you. If you have a hard problem trying to get them, reach out to the Food Administrative Research Education, also known as FAIR. They can help you sometimes locate different places. You might have to drive far. Also, specialty pharmacies have been able to try to help and get them out to you. So those are my words of wisdom.
Wonderful. And my last words of wisdom are, if your big box store is giving you a hard time getting it, call other pharmacies. Like, I called my family pharmacy and I said, hey, are you able to get any EpiPen? And they have a different warehouse, a different source than CVS and Walgreens, and they're able to get it. So just call around, see if there's somebody else who might have another.
Now, would they be able to transfer my prescription?
Oh yeah, definitely.
Okay, I didn't know that.
Yeah, as long as it's not like one of the hard controlled substance pain medications, they can usually transfer it.
Okay, cool. Good to know. That's a good thing to know to the people.
Yeah. And they're usually a lot more friendly too.
Seriously.
Yep. So, Ashley, thank you so much for taking the time in between getting home from the hospital and going to another side effect coping doctor's appointment, right?
Yep. Got to go to the dentist, take care of those teeth.
Those teeth that prednisone and other
that are ruined.
Have ruined. Like, you showed me a picture, so gorgeous. Like, you had this perfect smile, and now so steroids. Yep. This is a badge of honor. This is your scar proving that you have gone through so much and you're still here to tell the tale.
Yep. And I'm still going to advocate and take care of everybody and anybody who has questions. So I don't know if you want to leave my email. I'll give it to you. If anybody has questions, they can feel free to talk, reach out to me, and anything like that.
Awesome. Yeah, I'll post it below.
Okay, cool. I'll give it to you.
Awesome. Thank you, Ashley.
All right.
Feeling better.
Thank you.
All right. Signing off is Dr. Megan, your prednisone pharmacist. I'm here to not just help you survive side effects, but thrive while on prednisone.